talking about the motor speech disorder called dysarthria. So first, let's start out with the description. Dysarthria is a speech disorder caused by weakness, paralysis, or poor coordination of speech muscles. It's going to disrupt the execution of speech movements, and speech will usually sound slurred, strained, breathy, nasally, or quiet. It's going to impact communication, social interactions, and the overall quality of life for the people who suffer from dysarthria. So a common question is if it is a development or an acquired disorder. So the answer is both. So for developmental dysarthria, it's going to appear in childhood due to cerebral palsy, brain malformations, or metabolic disorders. It's going to have persistent speech distortions and difficulty coordinating movements. On the other hand, there's also acquired dysarthria, which occurs after normal speech development happens. It's caused by stroke, brain injury, Parkinson's, or brain tumors usually, and this is where we see more cases of dysarthria usually. So some of those areas of impact are going to include speech production. So this means that their speech is going to sound like an impaired articulation, it's going to sound slurred or distorted. For that voice quality, it's going to sound strained, quiet, or monotone. For the prosody, it's going to be disrupted rhythm, stressed, or intonation patterns. And for communication and social functions, these people are going to have reduced intelligibility, which is going to lead to frustration or social withdrawal from the people around them. And for respiration, it's going to be weak breath, support for speech. So some of those service delivery models include one, the educational setting, which is going to be support for children with developmental dysarthria. It's going to involve collaborations with teachers, IEP planning, and classroom accommodations. And the SLP will work closely with teachers and families to ensure that the student gets what is best for them. The focus in this setting is going to be for functional communication for learning, social participation, and academic success. In home health, we're going to see functional everyday goals that are being worked on in natural settings. This is going to focus more on everyday communication needs such as talking, making phone calls, managing needs, and doing those daily routines. Moving on to hospital and private practice. In the hospital, SLPs get to assess patients after stroke, TBI, or surgery. They're normally going to be a part of that multidisciplinary team. And then they'll focus more on early identification of these motor speech disorders, which dysarthria. And the goal of this is to create a functional level of communication, preparing that patient for the next level of care. Moving on to private practice, we're going to see individualized therapy for adults and children. That's going to be more long-term. SLPs can adjust the duration and intensity of the lessons depending on the client's goals and how long their sessions are. And they're going to focus more on intensive exercises and motor speech strategies. For the evidence-based assessment, I chose the assessment of intelligibility of dysarthric speech. It's going to be an objective measure of speech intelligibility. It includes reading passages in repetitive tasks. It's going to identify specific speech impairments in track therapy process. So this is going to start with a client reading or repeating a word and sentence. Then a different listener is going to write down what they hear, and then the percentage of words understood equals their intelligibility score. Another thing I thought we could focus on was the oral mechanism examination, which is going to check facial tongue muscles, strength, coordination, and tone. Moving on to our evidence-based treatment, we see Lee Silverman's voice treatment, which is mainly designed for Parkinson-related dysarthria. This is going to consist of sessions for about an hour a day for 4 days a week for 4 weeks. And the aim of this is going to improve respiratory support, articulation, vocal fold closure, and speech intelligibility. Moving on to some other additional treatment approaches, we see respiratory training, which takes place in a hospital more of. It's going to strengthen breath support for speech. We also see rate control strategies, which is to slow down speech for clarity. And we also see prosody training, which is going to improve rhythm, stress, and intonation patterns. So to conclude, dysarthria is a motor speech disorder that is caused by neurological damage. It can be developmental or acquired, mainly in adults, it's going to be acquired. It's going to affect speech production, voice, prosody, and social communication. And learning more and educating ourselves on evidence-based assessments and treatments as SLPs can help us improve our patients' intelligibility and their overall quality of life. So thank you for listening to my speech today, and I hope you have a great rest of your day. Bye!